Hello, and welcome to this video. If you're watching this, you've recently had a hysterectomy, and we're here to help guide you through your recovery process. You just had surgery, so now it is your time to heal and recover. Rest is crucial in the days and weeks after your surgery. It's important to give your body the time it needs to heal. You'll likely feel fatigued, which is completely normal. Try to listen to your body. Take naps when you need to and avoid overexerting yourself. Your healthcare provider will give you specific instructions on pain management, whether through prescribed medication, over-the-counter pain relievers, or techniques like heat or cold compresses. We advise that you take a stool softener if you do choose to take the prescribed pain medication, as this medication can cause some mild constipation. If you were previously taking a blood thinner, restart it according to your provider's instructions. You may experience some discomfort, including cramping, pelvic pressure, and mild burning with urination as your body heals. However, if the pain worsens in severity or duration, please call your doctor. Maintaining a balanced diet is crucial during your recovery. Focus on eating nutrient-rich foods like fruits, vegetables, lean proteins, and whole grains to support healing. Staying hydrated is equally important, so be sure to drink plenty of water throughout the day. As for alcohol, it's best to avoid it in the early stages of recovery, as it can interfere with your medications, dehydrate you, and hinder healing processes. Smoking can also slow down your recovery process, as it affects circulation and increases the risk of complications. If you smoke, try to quit or reduce your smoking for the duration of your recovery. While rest is important, light movement can help your circulation and prevent complications like blood clots. We recommend activities with light duties. It is okay to climb stairs and bend over, but avoid repetitive activity. Avoid lifting more than a gallon of milk, around 10 pounds. You may resume normal activities 6 to 7 weeks after the surgery. However, please avoid any sexual activity until you've been cleared by your doctor. If you're unsure about what is safe, always check with your doctor. Taking care of your incisions is a critical part of your recovery. Keep the area clean and dry until your follow-up appointment, where your provider will remove your stitches or dressing. In addition, avoid bathing in pools or hot tubs to ensure the incisions stay clean. Mild bruising, redness, or scant bleeding from the surgical site is normal. But if you notice any excessive redness, swelling, or fresh blood or pus drainage, contact your doctor immediately. You might also notice some orange urine and vaginal bleeding during the first days after the surgery. This is completely normal. Please note that this should not exceed a pad or a liner per day. If you notice that you need to change your pad every hour, please call your doctor. If the bleeding becomes uncontrollable or you lose consciousness, please go to your nearest emergency room. While most recoveries are smooth, there are a few other things you should be on the lookout for. Immediately after surgery, shortness of breath, chest pain, dizziness, extreme pain that does not improve with medication, pain in the calves, and then 4 to 5 days after surgery, you should be on the lookout for a bladder or bowel injury, a fever higher than 100.4 degrees Fahrenheit, flank pain, vomiting. If you have any questions or you notice any of these symptoms, please go ahead and call 832-632-5088 for the Clear Lake location. And remind them that you had surgery and want to speak to someone on the team. If symptoms include shoulder pain with shortness of breath, loss of consciousness, or severe chest pain, then go to your nearest ER. It is important that you attend your follow-up appointments with your doctor or nurse practitioner. Remember that you have one 2 weeks after surgery and then 6 weeks after surgery. After the 2-week follow-up appointment, you will be evaluated for possible complications, and the provider will discuss intraoperative and pathological findings, if any. At the 6-week appointment, the vaginal cuff will be removed. It's not just your body that needs healing. Many women find that emotional recovery can be just as important. If you're feeling sad, anxious, or uncertain, it's okay to reach out for support. Whether it's talking to a loved one, a counselor, or your healthcare team, your emotional health matters just as much as your physical health. Remember, every woman's journey after a hysterectomy is different, but with the right care, support, and patience, you will move through this healing phase. Be kind to yourself, take things one day at a time, and don't hesitate to reach out to your doctor with any questions. You're not alone in this. Thank you for watching, and we wish you a smooth and restful recovery.